welcome to Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things MS, health and wellness, advocacy, and we'll even throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Well, Happy New Year. Happy 2024 to all of you out there. I'm Dr. Mitzi, the Nerdy Neurologist, and I am excited to be starting season 4 of Brain Chat with the Nerdy Neurologist. So very excited about the topics that we're going to discuss this year. We've got some amazing experts to provide their expertise from the clinician standpoint. We've got some phenomenal patient advocates. So I just cannot wait for you guys to hear some of the conversations that we're going to have this year. For those of you who are new to Brain Chat, log into the chat. Let us know where you are viewing us from. I bid you greetings from Atlanta, Georgia. And I hope that everyone is staying safe and that their new year is going well. So we're going to get right into this conversation. Today's topic is MS in the Black community. So every Black History Month, I like to talk about MS in the Black community because this is a topic that is very near and dear to my heart, as I have family members who have been diagnosed with multiple sclerosis. And it's also a passion of mine to help underserved communities. So I've got some amazing guests with me, and I'm going to jump right into introduction. So we have Dr. Tirashim Gayeng, who is an assistant clinical professor at the Ohio State University Wexner Medical Center. She serves as a clinician there. She also is the program director for the Multiple Sclerosis Fellowship Program. She specializes in MS as well as other neuroimmunological disorders of the brain and spine. She has a special interest in experimental therapeutics. I'll let her talk a little bit more about what that means. She also has a great interest in clinical trials and medical education. She trains aspiring MS specialists in comprehensive clinical care and clinical research. And she also does multidisciplinary clinics with our rheumatology colleagues to help treat rheumatologic disorders as well as neurosarcoidosis. She is passionate about empowering patients with personalized interdisciplinary clinical care, quality education, and clinical research. We also have Dr. Maima Akinsanya, who is a fellowship-trained neuroimmunologist and assistant professor of neurology at Georgetown. She works out of the Southern Maryland Hospital. She completed her neuroimmunology fellowship at the National Institutes of Health, where she conducted clinical trials, particularly focused on multiple sclerosis and neuroimmunologic disorders. Her focus and career and passion is in advancing health equity for African American patients with multiple sclerosis through research and clinical care. And last but certainly not least, we have Miss Donia Marie, who was born in Pittsburgh, Pennsylvania, and in 2006 was diagnosed with multiple sclerosis. She's going to share a little bit about her story with us today as well. From 2013 on, she has been an active part of the MS community, working with the National MS Society. I'm sure you've seen her in multiple video campaigns. She was part of the We Are Illmatic campaign on social media for women of color with MS. She's been interviewed on multiple media platforms and has done so much work as a patient advocate, including being a self-help group leader. She has received numerous awards, including in 2020, she received the Inspirational Person of the Year Award for the Southern California, Nevada chapter of the National MS Society. She received the 2020 Ladies Operating Very Effectively or Love Overcomer Award, and most recently received the Volunteer Inspiration Award. Welcome to Brain Chat, ladies. Welcome.
Thank you.
Thank you. Really excited to be here.
Absolutely. Absolutely. So thank you guys so much for taking out your time to spend some time with us and talk about, a topic that I think we're all very passionate about, and that is MS in the Black community. But before we get into it, whenever I have guests on Brain Chat, I love for you guys to tell us a little bit about your story and how you got involved in working with MS and why you're so passionate about this topic. So we'll start with you, Dr. Gayeng.
Yeah, sure. Thank you so much for having me here again. I was here some time ago and I'm happy to be back. I went into medical school not really thinking I will become an MS specialist, but during medical school, I developed my interest in neurology and then, ended up in neurology. And then during my neurology residency, I started taking care of MS patients. And I just, there was just something about it that made me feel this is what I really want to do. And so
Mhm.
that was kind of how the journey began. I really didn't have a strong exposure to MS, before I went to the medical field. But, once I was, in neurology, I felt like this was a very, very exciting field. And that, this is something that I'm really passionate about. So to lift up the story.
Absolutely. Absolutely. How about you, Dr. Akinsanya?
Yes. So in medical school, I came in pretty open-minded, knowing I was interested in the brain, but didn't know was I going to go to neurology or psychiatry. And one of my first exposures to neurology was actually with an MS specialist. And so I worked with her. We even did a project together, and I really got to know the patients and interact with them. And I really enjoyed, the MS community that I was exposed to. But still went into residency with a pretty open mind. But I just kept coming back to inflammatory disorders, kept coming back to MS and neuroimmunological disorders, and just realized, this is what I like, this is what I enjoy, and this is what I'm intellectually curious about. So I'm not going to fight it anymore. Just going to accept that MS was the right path for me. And I just really enjoy the MS community. I enjoy working particularly with people of color in the MS community, and building a partnership together where we are endeavoring to improve health and outcomes with providing the highest quality care possible. So I enjoy being an MS neurologist.
Awesome. And tell us a little bit about your journey, Donia.
Yeah, so first of all, thank you, all three of you, for choosing MS and being so amazing. I really appreciate it. I didn't get to choose whether or not to go in MS, but I was diagnosed with MS in 2006. And I'm also a caregiver for my father, who was diagnosed with primary progressive MS. So I'm kind of grateful for my diagnosis so I can help him a little bit. Well, help them, period, not a little bit. I'm also I'm a MS mama. They call me their MS mama. I have a support group for high school and college students diagnosed with, actually, now we moved it down to elementary. So from 25 and under, I have kids diagnosed with MS, and those are my babies. I don't have my own. I'm single, no kids, but they are my kids now. So I'm grateful for that. I love being an activist for the MS Society. So we go to the Capitol, once a year, do a couple of visits to convince people to vote for health bills, things that support the MS community. I think it's so important to, have bills that support the doctors to be able to do telemedicine and things like that. But I am hardcore MS. I'm like, anything y'all need me to do, I'm doing it. And actually, Dr. Mitzi was my MS neurologist when I lived in Atlanta. And I remember sitting in her office, like, I'm going to move to California. I'm going to go down here. And she's like, okay, supporting and all that. But I just felt like I needed to come, and moving here is how I got involved in MS so much. But Miss Atlanta, was sad to leave Dr. Mitzi, but I'm grateful I came. And I live in Los Angeles, specifically Compton. So that's a little
Well,
bit.
you have flourished. You have flourished where
Yeah.
you are now planted. So you're in the right place.
Thank
So
you.
I love these conversations because I like to have different perspectives, right? Because I think the older I've gotten and the longer I've practiced, the more I realize the importance of having conversations about people with MS with people who have MS, right? So we as a clinicians provide a certain perspective, but we can't replace that perspective of you, which is why I'm so glad that you came to spend some time with us today. All right, so let's get into it. why is this topic important, right? So we know that for the past couple of years, since 2020, there's so much stuff that's gone on in the country, so much about structural racism, et cetera. DE&I has become a buzzword, and now it's kind of like not a buzzword. But why are these conversations important? I think that's the first thing I'd like to get you all's perspective on as we open up this conversation. Whoever wants to jump in.
Well, I don't mind going because I had an incident that happened this weekend. I think it's very important. Number one, a lot of people don't understand MS. And so they're like, I know about the muscle disease. And I'm like, no, that's not, what it is. And have had someone that she's been going to different doctors, and she's doing what she's supposed to do. Well, the incident is, she's asking a question, what do I do? What is with the doctors? And she's gone for years, been going through this. I've been talking with her, and someone responded to her, you have to advocate for yourself. She's not knowing her background. And so I had to explain to her, I said, she is a Black person with an accent. She's from Africa. And so she was dealing with a lot of lack of care, not believing and all this. And she's like begging, like, this is what I need. So I had to explain to her, like, we don't get hurt the same way. We don't, you never know what you'll get. Sometimes you'll get a great doctor, sometimes you'll get someone else. So I just think it's important for people to understand, like, we're doing what we're supposed to do, just not getting the same results, and just learning more about MS, but then also the pediatric is important. So for me, because I have to fight the teachers sometimes where it's like they're actually feeling that way. It's heartbreaking for them because they're trying to do their schoolwork, do what they need to do, and unfortunately, you can't see their symptom. And so I've given them tips and hoping that, their 504 plans get honored and not, treated as though they're not doing what they need to do, if that makes sense. But yeah, it's important to have that, understanding of things happening internally sorry, I'm not in a wheelchair to show you my MS.
Yeah, so that's extremely important. So, what I hear you saying is education, right? So education amongst the community, because there are some diseases that we know are very common amongst communities of color, right? If you talk about hypertension, people know about it. If you talk about diabetes, sugar, whatever grandma, grandpa calls it, people know about it. But when you say MS, it's not something that's a buzzword for people. So number one, there's a need for education for people to recognize the symptoms of MS, right? And when to be looking for it. And then, for us as neurologists and as medical, people part of the medical community, it's important for us to educate our colleagues, because I think there still is some misperception that MS does not occur in Black people or in some populations. I still have patients, unfortunately, that were coming in as late as last year telling me their doctors were like, well, we didn't think MS because you're Black and Black people don't get MS. So talk to us a little bit about, why this conversation is still important, Dr. Guine. Give us your thoughts.
Yeah, I mean, I think, you guys nailed a lot of great points. I went to medical school learning that MS is a disease that affects white people or people from a Caucasian background. And so, we always joke with, whenever I'm talking to the students or the residents, like whenever we took a test and we saw a young white woman with acute neurologic disorder or symptoms, we always thought, oh yeah, that's MS. Like, that's kind of ingrained into our minds. And so that perception is there for a reason. That was what we were all taught in medical school when we were growing up. But the new evidence that's coming out is telling us otherwise. MS is still most prevalent in people that are of Caucasian or white, like from a white background. However, the two studies that came out recently on the incidence of MS, and incidence means who are the new people being diagnosed with MS, there were two independent studies that showed that Black women were the highest. amongst these groups.
Mhm.
And so the story is definitely changing. And I'm not sure how much the story has changed in the way we teach and the way we educate our providers and our medical students. But MS definitely affects every single race. And,
Mhm.
at this point, the highest incidence is in Black women. So there's an uptake or there's an increase in that incidence that we see in Black people. We need
Mhm.
studies. We need a lot of attention to this to try to understand what's going on and how MS is affecting different types of people. But I think the message to everyone is MS can affect anyone that walks through the door, whether they're coming
Right.
in the emergency room. Anyone coming through can have MS. I still have patients that tell me, my doctor said, as you said, my doctor said, people like you don't get MS. I think it's not likely, and that has shown that there's a delay in diagnosis, which impacts long-term outcomes. Because if you're not
Absolutely.
diagnosed early, then you're not on a treatment early, and that leads to more disability over a long time. So this is a very, very important message to both the medical community,
Mhm.
just the community at large. To say MS can affect everyone. Think about MS. You know, Black people can get MS, and it's something we want to identify very early and start on a very great treatment plan very early on.
Absolutely. And so this increased incidence, right? So, again, I've been abreast of the research. Certainly, we were training, maybe a little bit before you, but not too much before you. But certainly have seen how our understanding of MS in various communities has improved. Do we think that we're seeing a higher incidence because it was ignored before, or are more people getting MS in general?
I don't know that we clearly understand, but it's probably a combination of different factors.
Hmm.
So yes, there is probably a problem where it was probably under-recognized.
Hmm.
So that could be an issue where people just didn't see it, even though it was right in front of them.
Right.
Um, and the other big question is also how much of this has to do with genetics or biology, or how much of it is social. It's kind of the access to healthcare, that the access to the resources that you need. So there's just a lot of unknowns in terms of how people get MS. Another interesting factor is that we see African Americans here, the incidence of MS is completely different from Africa. So
Hmm.
people that have migrated with the migration studies, we see that the incidence of MS is different when you look at people's home countries, whether you're looking at Hispanics or African Americans versus here in the US. So how much of it has to do with geography or where you live? So there's just a lot of different factors where there's probably multiple factors that are affecting that incidence that we really need a lot of research to try to understand. But we definitely do see an uptake, and we have to be equipped with the tools and the people to take care of all the patients that are coming through, so that we're not failing our patients and seeing them more disabled over a long time.
Hmm. What are your thoughts, Dr. Akinsanya?
Yeah, something that you were kind of already segueing into that I've been thinking about with this conversation is that it's just very well documented that people of color, particularly Black people with MS, have worse outcomes.
Hmm.
And, for a while, I believe it was assumed to be a genetic or biologic difference, which may, be part of it. But my passion is what is our role as healthcare providers and how are we impacting the outcomes? And while, it's easy to just almost use genetics as a scapegoat, like, oh, it's just this, if you're from this ethnicity, if you're from this background, you're going to have worse outcomes and there's nothing we can do about it. I do believe it's very important to keep this conversation at the table because there are things that we can do as healthcare providers, and there are probably things that we are either doing or not doing that are negatively impacting the outcomes of our patients. And I believe it's very important to hold ourselves accountable to those things and to be able to research them, document them, and to provide solutions to how to provide better care in the face of systemic and systematic racism and things like that, and treating people differently. And like was said before, the face of MS previously was a young white woman, and so there was likely a lot of cases of bias that, oh, your symptoms are not due to MS, it's probably something else, and people were going underdiagnosed from that. And so, that's my 2 cents in this particular conversation, is what is our role as healthcare providers in the healthcare system, and how can we look at the different things that we've been doing that are negatively impacting our patients when we should be providing excellent care and doing the best we can to aid them in their journey of health, and how can we rectify things, and exposing an issue, or exposing, that people of color, Black women are more likely to be the new diagnosis of MS these days, is just one small piece of the puzzle.
Right.
There's so many things and issues that we need to address. So this conversation, in my mind, is very far from over, and it should not be like a fad or a trend. It's something that we have to realize that for decades, probably centuries, we have, as long as we've known about MS, we have probably been mishandling certain populations. So as long as it's been that we have been mishandling, it's going to take probably twice that time to rectify, the whole system of how we're caring for people.
Yeah. So, I mean, so there's a lot of work that needs to be done, right? And certainly, you all have raised so many very interesting points. Number one, the role of biology, right? Genetics or other, biologic factors versus what we call social determinants of health. So, can you get access to the doctor, right? Do you have access to a specialist? Are your symptoms believed when people are seeing you? Do you have insurance? If we see you and we diagnose you, can you get on medicine? Can you stay on medicine, right? Do you know about resources that are available to you to utilize? There's so many factors that lead to poor outcomes that are not at all related to the MS itself, right? These are all outside factors not related to how severe your MS is that could really impact how people do in the long term. And I think that, these conversations are extremely important, because if we improve care for one group of people, we improve care for everybody. And so there's so much that we can learn from groups that have traditionally been, overlooked or underserved. And so I think this is still a very relevant conversation, as many of you have said. And I want to get into those solutions. But before we get into those solutions, Dania, tell us a little bit about your diagnosis experience. Was it delayed? Were there things that, could have gone better, or could have been more ideal in your experience that may have helped you get diagnosed early? Or did you have, pretty smooth transition to diagnosis?
Okay, so first, well, I'll say this as we go on. So in 2004, I worked at Kinko's. I miss work. That was probably my favorite job. I've learned, I still have things that I take from Kinko's.
I used to go to Kinko's all the time. I hadn't seen the Kinko's in a long time.
Yeah, they are gone. They are now FedEx office. And it hurts my heart and tells me how old I am when people go, "What's Kinko's?" And I'm like, "Ooh, okay." Like, I'm old. But I was walking and I felt like I was walking to the right. And like that VA commercial where you're kind of like walking sideways. And so I went to my doctor and my PCP, and he's like, "You're walking straight." So, but I felt like I was going to the right. And so he ordered a test where they, stick everything on your head. You look at the screen, did I think I did a hearing test, and I did an MRI. And I got the results from the MRI. I went to a doctor in Decatur, and he's like, "I don't see anything wrong with you. Like, I don't see anything." And then I said, "My dad was diagnosed with MS." And he goes, "Aha, that's what it is." And I was like, "I'm not listening to that, because I just told you, what it was versus you telling me." And so I ignored it, just because you at that young, you don't get MS at 24. So you don't know what you're talking about. And so 2 years later, my body went numb from my chest down, and my fingers, numb. And my mom's like, "You need to go to the emergency room." And I'm like, "They can't do it. Like, no, they can't do anything in the emergency room." And so I went to emergency room. They referred me to a neurologist. He sent me in to get MRIs. I was probably in that machine for like 3-4 hours because he did everything. He was like, okay. And when we went back to him, he's like, this is, conclusive of MS, and I'm just like, what? And my sister was kind of shocked, like, what did she do? And they're like, there's nothing, that you did. They actually don't know. Well, we don't know, how MS starts and all of that. And so I was like, well, God is going to heal me. So I did not do medication. And I that's my slight regret. And I only say that because of where I am today. But if I went back now, I would get on medication early and not go, I'm going to trust God to heal me. I'm going to do the natural way, and didn't do everything I needed to do for the natural way. And so I didn't really know, like, go to an MS specialist, but got on a medication, did not do well on it. But then, led to others. But yeah, my advice, and it's a lot of people when I hear this now, I'm like, no, get on medication. But if you're going to do natural, you better stick with it and do it, because MS is not something to play with. You don't like, once that lesion comes, you don't know if you're going to recover from that or not. So that was my journey. And I haven't, fortunately, they didn't send me all around the world trying to figure it out. It was my dad being diagnosed, which helped me get diagnosed better, or faster, I should say.
Yeah, so many things. Thank you so much for sharing, your story and for being so candid. A couple of things, certainly the fact that your father had MS would kind of raise suspicion. But many people who are diagnosed do not have a family member who has MS at all. Or if they do, they don't know about it till they get diagnosed, and they go back and ask mama. And then mama says, great auntie Betty on the second side, cousin twice removed, whoever, actually had MS. And so, you got an MRI fairly early. I certainly can I recount stories of many of my patients who had symptoms that were similar to yours, where MRI was not one of the first things that was ordered. And I think one of the other difficulties is that the symptoms sometimes go away. So in the beginning, those relapses can last for a couple weeks or a month, and they go away. And so you're like, maybe I slept wrong. Maybe I should have had a V8, right? Maybe, it got better. So, I'm good. I don't need to worry about this. And so, I think there are a lot of points in your story where, possibly differences in maybe the way you were educated about the MS, or maybe the way you were approached, could have potentially changed your thoughts about treatment. Maybe not. But even if I have patients who, let's say, don't want to start treatment and we have conversations, I underscore the fact that, okay, if this is what we're doing, we need to be following up. We need to be getting those MRIs. You need to be coming back to see me, because if something changes, then we have time to jump on top of it, hopefully, before you start having issues. Tell us your thoughts about that, Dr. Akinsanya. I know you said you're passionate about how we can improve outcomes. Give us some thoughts about, ways that healthcare providers could potentially improve outcomes or better serve populations, of people, particularly with a story like Donnie's.
Yeah, one thing that comes to mind that's already been said in some ways is just to believe the patient and their symptoms. And as we know, with MS and other related disorders, sometimes the symptoms are what we call invisible, or may not be present on exam at the time that we're evaluating the patient, but not to assume, no, this is, anxiety, or this is fatigue, or, that the patient doesn't know their own body. Like, I like to try and go into my encounters with patients with the assumption that they know their body best. So if they're saying that there's something going on, that I trust them, and I trust what they are describing in their body, even if it doesn't, perfectly line up with something that can be localized. I know as neurologists, we are big on localization, and, everything should add up. But something that was told to me pretty early on in my training that I've always hold on to is that patients don't read textbooks. Like, patients' bodies do not read textbooks. So it may not be exactly how, we we would imagine, the lesion and the symptom localization to be. So just to believe them and do a thorough evaluation, however that may look for whatever the symptoms are. And I would rather do a thorough evaluation and, there's nothing there and we just monitor than to miss something later on. So that's one of the main things that comes to my mind, is to be thorough with each patient, irregardless of, if it quote unquote fits or not.
Right. I think the other thing to keep in mind is that also symptoms can worsen with continued activity or as the day progresses. So my patient that comes and sees me at 9 or 10 o'clock in the morning, after they are well rested after an hour in Atlanta traffic, is not having that same issue that they'll have at the end of the day after a long day of work or doing things around their home. And that walking is worse after that continued activity. And I think that's something else that people have to keep in mind. So again, recognizing number one, as clinicians, that we do need to believe people when they come in and see us, but also recognizing from our patients, that walking to one side is not normal, because I have all kind of folks that come in and say, well, I thought it was normal that my memory was bad. And I'm like, well, you're 20, sugar. Your memory should not be bad at 20. You know what I mean? Now, if you were 90, that'd be a different story. So I think the other piece is that we as a community have to pay attention to our bodies. And if there is something that's not right, we also need to make sure that we're getting it evaluated, because it's not normal, for your leg to be dragging at the end of the day. It's not normal for you to be tripping over your foot. It's not normal for your whole body to be numb from one place. Like, you didn't sleep wrong to do that. Somebody needs to see you and get that evaluated and check it out. Any other thoughts about that, Dr. Guyane?
Yeah, no, I think she excellently put it. I think, as a doctor, one thing I always remind myself is, we have to take a degree of humility when we see patients, because, we've gone to med school, we know a lot, and sometimes, you just hear something and you're like, oh, I know exactly what that is. This is, you just put it in a box and you're like, okay, you're telling the patient, this is what you have, and you're not really listening, or you're not really expanding your mind to say, can I just listen and learn from what the patient is telling me? And, I always have to remind myself just to be quiet, ask the right questions, try to allow the patient to educate me about what they're going through, as opposed to just kind of quickly coming up with my own assumptions of, okay, yes, I know exactly, they said this, they said that, I'm putting that together, and I think it's this, or I think it's that. And so I think, and even when I teach medical students or residents, or sometimes they come to me and they say, okay, this is what this patient has, and I'm like, okay, go back, ask more questions, listen to the patient, do a very thorough exam, and then let's go back and see the patient. Because we have to learn from patients. Like, patients come and they know what's going on. Sometimes they may not articulate it the right way. And sometimes they may try to exaggerate because they want you to believe them, because everybody else has. And sometimes
say that again. Say that again.
Yeah,
say it again.
People see that and just say, oh no, this patient is functional, or is malingering, or they use all those words to try to dispel what the patient is saying. But I'm like, well, I have to just listen, and I have to just try to validate what the patient is saying. And it takes a lot of humility to do that, because I might think this is what I feel like it is, but I have to humble myself and say, let's just listen to what this patient is saying, and let's do due diligence and not miss anything. So like, if a person has been dispelled so many times, sometimes there's a distrust of the system. Sometimes they may try to make you believe them, and sometimes the way they do that is by exaggerating some of their symptoms, and that is kind of all. I mean, it's part of that presentation, and we have to take it as what it is and just do that due diligence.
I just wanted to hop in very briefly. I loved everything that you just said, especially about patients sometimes wanting to be heard and may exaggerate their symptoms or their story to be heard because they haven't been heard before. But also what you said about asking the right questions, that is so important. And I believe we have to also remember health literacy, when talking with certain patients. And there's some people that if you ask them, have you had any transient weakness, temporary weakness, they will know exactly what that is and be able to say yes or no. There are other people you have to describe it differently. You can't just say, have you had any temporary weakness? You have to say, like you said, Dr. Williams, was your leg ever dragging? Were you ever dropping items out of your hands? Was there ever difficult to hold your utensils, or, however you ask the questions. But I think it's important to not just assume that, oh, they said no weakness, no numbness, no tingling, and move on from there. But to really ask questions in different ways to make sure that you are describing things sometimes rather than asking black and white, close-ended questions.
Mm-hmm. So it sounds like there's a lot of work that needs to be done, and one of the things that I love about the conversations I have on Brain Chat, number one, I get to talk to brilliant minds like you all and, have these amazing conversations, but I also like to be solution focused, right? I think for so many years, particularly when we talk about underserved populations, whether it is the Black community, whether it is the rural community, whatever community is, for MS, men are underserved community. When we talk about these, oftentimes we spend a lot of time focusing on, okay, this is the problem, but I also love to talk about what are the solutions, like how do we move forward? What are the next steps? Where do we go from here? And so I think in the last few minutes that we have, I want to focus on, what are some exciting initiatives or research that's come forth that's really kind of opened your eyes? What are some exciting projects that you all are aware of? And what are some resources that we can give to those out there, whether they're clinicians, whether they are patients who want to learn more, right? And maybe employ some of these techniques into the way they treat patients, or for people living with MS, into the way they advocate for themselves, or for care partners, how they advocate for their loved ones. And so I'll start with you, Donia.
Yeah.
Where do we go from here?
Yeah.
What are you excited
I
about?
almost started to sing the song.
Where do we go? Right.
But I will say education, like I was talking earlier, so important. Something that we're working on right now with the youngsters is showing, the different ages or the things that they deal with, is bringing awareness that somebody that's a child can be diagnosed with MS. And so because MS Awareness Month is coming up, so we're doing that. And then, beyond for them, because that's my heartbeat, with them. And so that's something excited about. But it is ask, if you have a question, ask, don't assume. I think that's super important. But with resources, I am like 100% go to the National MS Society's website. They have a whole lot of information, and while you're in there, you can sign up to be an activist. And because we need them everywhere, because we need all the offices to say, can you support this, can you do this, and bringing it to their attention. But I just think education and even the people diagnosed with MS to be transparent. For me, when I was first diagnosed, the first question was, how long until the wheelchair? Because they thought that I was just my dad has primary progressive and he's bedridden. So in my family's mind and my friends' mind, they're like, so you're just going, there's a step, like there's steps in MS, and there's not. MS is a snowflake disease where you never know. So just getting that education out and awareness and transparency, I think, is so important. So that's what's coming up over here.
And that's, those are such key points. And I love what you said about transparency. I do encourage people to share their story with somebody. So maybe it's not for you to go on social media, but there's so many people
Right.
who think they're alone, and when they see you, when they see, other amazing MS advocates like Victoria Reese with We Are Ill, like Tyler Campbell, it helps people to know that they are not by themselves.
Right.
And so I think that transparency transparency and sharing that story is an essential part for people engaging in the healthcare system, right? So there are some people who have really quick diagnosis, some who didn't, but people, again, sharing those learnings and lessons can help other people that come behind you to hopefully have better outcomes, just as we share, the experience that we have. So I think that that's so important. And I encourage people to do that, when they get to a level where they feel comfortable doing that. Tell us a little bit about what you're excited about, Dr. Akinsanya.
Yeah, like you said, looking to solutions to develop solutions that will hopefully be effective, for our communities. So something that I'm looking at is how to get the patient and provider perspective for access to care for Black patients with MS, and utilizing those perspectives to develop interventions. And I think it's very important to get, like you said, not just to have conversations and roundtables with only providers all the time, but to make sure we have the patient's perspectives, because they are ultimately the people who are affected by our decisions, and they provide valuable perspective. So I'm excited to do more like community-based interventions, and having community buy-in into interventions, and making sure we're working collaboratively and not just in silos. In medicine, we talk about silos a lot, but we often talk amongst each other, but we can also work in silos, not working with the community. So I'm looking forward to really just including the community in interventions and in planning and development.
Right. And, it's so interesting. I get to sit into so many interesting conversations with patient advocates. I participated, in work. I sit on a board for a patient advocacy organization. I've also sat in conversations, and it's a different conversation. And, as you spoke earlier, Dr. Guying, it really is humbling. You have to come with a sense of humility, because here I am, the MS expert. I think I know everything. And I'm like, oh, I didn't know that. Oh, okay, well, let me just sit over here and listen and learn something, and this will help me to do better when I go back and serve my patients. And so, I think it's so important for that collaborative approach, for us to come up with solutions. We have to work directly with the community and not just assume that we know what people want because we see people on a regular basis, but include those voices like Donia's voice, so that they can have an active part, whether it's participating in research. I've participated in clinical research trials where we've had patients, be a part of the steering group, and all the doctors are like, no, nobody's going to want to do that. And the patient's like, no, we want to do, and so again, not making those assumptions, but really working together to come up with solutions is extremely important. All right. Tell us what your thoughts are, Dr. Guying.
Yeah, just really wonderful points. I feel that everybody's talking about. I think education is key, educating the medical community, educating patients. But one thing I always talk to patients about is I want you to be empowered to be a voice for yourself and to advocate for yourself. And, you have to have a voice on the table. There are times that I talk to a patient and they just tell me, just do whatever you want to do. Like, I trust you. Just whatever you do is fine. I'm like, no, I want you to understand the differences. I want you to understand this treatment versus this treatment. And I need your voice. Like, you have to be part of this decision. And, patients, I tell them, get a second opinion, right? Educate yourself. There are times that, you heard this, but you really want to figure out, okay, what are my other options? It's totally fine to get that second opinion. And I just want I want each of my patients to get to a point where they take ownership and they work collaboratively with their doctor and don't feel like they just have to do whatever the doctor tells them. So they understand what they have, they understand what treatments that have been talked about, and they are part of that voice that makes a decision into, okay, this is what we're going to do, and this is what it's going to look like long term. And so, education is a huge component of that, meaning they have to understand what's going on, and they have to have the ability to say, okay, I want to hear something different. I want to, talk to somebody else. What about research? Research is available for me. So there's just a lot of things that come into it. But I just always want my patients to understand what is going on. And I want them to feel empowered that, I have MS, but I can be part of that driving seat that makes decisions. And I can work with my doctor to do what's best for for that individual. So I think that's a huge component. I do a lot of clinical research, so I really, always talk to my patients about research, and I always tell them about, you want to get to a place and just hear about the types of research going on in MS. We always talk about the fact that there's a lot of diversity in clinical research. We want that diversity. So, that is an option. If you get to be in a very innovative clinical research, that puts you years ahead of the game to that intervention becoming available in the market. And so, that is one way that you can make a decision to empower yourself to do something that may be the best for you. And so I think it's just being part of that table, having a voice in that table, and taking that ownership of, this is your life. You're going to work collaboratively with the doctor, and you're going to be part of that decision making that's taking place. That's what I always aim for my patients, and I always want them to be part of that voice and part of that decision that we're making together.
Amazing. And I think for me, I am just so elated just to be able to have conversations like this. I remember very early on in my career sitting in the back of the room and saying, let's talk about Black people with MS. And everybody was like, no, we don't want to talk about that. So I'm just so excited to see our understanding progressing, to see, the call for research, the call for better understanding, the call just to even examine social determinants of health and why people can or can't get access to care. The call to action for clinicians to do better in some areas where we can do better, and the call to action for patients to educate yourself, be an active part of that team. Know that your voice, you are the center of the healthcare team, right? Not the neurologist. You are at the center. And so you have a voice in making sure that we're doing the right things, to serve you, because your MS is going to be very different from anybody else's MS. And so I'm just excited. I'm excited about some of the studies that are coming out. We've got some research focused on the Black and Hispanic population. We're going to be reporting some data out this year that I'm very excited to share. And so just a wealth of things. But this is just an amazing time, I think, in the field of neuroimmunology, because we're learning, we're growing. And I think we're recognizing that MS is not the same MS we thought it was in the 1960s. And so we have to learn to adapt and change and to be able to serve the communities that are in front of us. So all those things I'm super excited about. And I want to thank each of you for offering your amazing and unique perspectives today. I am sure that our Brain Chat audience will get so much out of it. Thank you all so much for your time. And thank you so much for sharing your perspectives.
Yes, thank you for the invitation.
Absolutely. And we also thank the National MS Society for sponsoring Brain Chat. All right, everybody, we'll see you again in 2 weeks, although I put up 4 fingers, 2 weeks with the next Brain Chat. Have a great one, everyone.